Armpit pain, causes and treatment. Armpit pain is often a sign of overexertion or muscle strain, but it can indicate a more serious underlying disease such as an infection, lupus or shingles. This video covers the common causes of armpit pain, when to speak with a doctor and how to treat the pain when it occurs. The armpit is the hollow underneath the shoulder joint. It is also called the axilla. The armpit is the point where the muscles that move our arms and shoulders connect with the bones. Some of these muscles also connect to the ribs. Major nerves and blood vessels also pass through the armpit, and it is home to several lymph nodes. Swollen lymph nodes usually indicate that a person is fighting an infection, but sometimes they can be a sign of cancer. The skin is thin under the arms and contains a large number of sweat glands. The warm, moist conditions may increase the likelihood of fungal or bacterial infections or rashes due to chafing. Possible causes of armpit pain. Many factors either contribute to or cause armpit pain, including some skin issues, infections, and immune conditions. This section will look at the possible causes of armpit pain. Muscle strain. Doctors describe muscle strain as an injury to the muscles or tendons. The fibers in the muscles and tendons may simply overstretch, or they may tear. People taking part in sports and activities that involve lifting, pulling or throwing may injure muscles and experience armpit pain. Strained pectoral or chest muscles, which people use for lifting and pulling, can often cause underarm pain. Damage to the coracobrachialis muscle or upper arm muscle, which assists people in throwing and pushing motions, may also cause armpit pain. Swollen lymph nodes. Lymph nodes are part of the body's immune system. They filter foreign bodies, including bacteria, and stimulate the release of immune cells, which destroy and remove these invading bodies. During infections, the lymph nodes fill with harmful cells and begin to swell. This enlargement causes inflammation and pain. Causes of swollen lymph nodes include bacterial infections such as tuberculosis, upper respiratory infections such as the common cold, viral infections such as the flu, sexually transmitted infections, cat scratch fever when a cat scratch or bite becomes infected, fungal infections, autoimmune diseases such as rheumatoid arthritis, wounds and skin infection, malignant diseases such as lymphoma. Swollen lymph nodes usually go down within a few days or weeks. If the swelling lasts for more than 4 weeks, a person should contact a doctor. Allergens and skin irritants. Many deodorants, antiperspirants, body washes, soaps and laundry detergents contain skin irritants and allergens. Some of this may lead to allergic contact dermatitis, a condition that causes itching, burning and tiny blisters. People usually get the rash a day or two after coming into contact with the allergen. Irritant contact dermatitis can result in an itchy rash, stinging pain, swelling and heat. As the reaction is almost immediate, people quickly learn what is irritating their skin. Bacterial and fungal infections. Ringworm or Tiana corporis is a common fungal infection affecting the uppermost layer of skin. It triggers a red, ring-shaped rash. As fungi thrives in warm, moist environments, the armpit is an ideal location for the infections that the fungi can cause. Ringworm fungi also use the keratin present in hair as food. Ringworm rashes can be painful and lead to inflamed, itchy and scaling skin. Bacteria also flourish in moisture and warmth, so bacterial infections can develop quickly and contribute to inflammation and pain in the area. Intertrigo. Friction and moisture in the folds of the skin can lead to a type of inflammation called intertrigo. Symptoms of intertrigo include itchy skin, pain, tingling, and burning in the affected area. Without treatment, secondary bacterial or fungal infections may also develop, causing further pain. Candida is a type of yeast that can cause intertrigo. It turns the skin red and causes the development of white plaque. Heartburn. Heartburn, in which stomach acids travel back up the esophagus or the pipe down which food travels, can cause shooting, sharp chest pain and less commonly pain in the armpit. Cyst. Cysts are painful lumps that can develop when body fluids build up in the armpits. They can become infected, especially by Staphylococcus bacteria, which usually live on the skin. Cancer. The lymph nodes in the chest, including those in the armpits, often work extremely hard when cancer develops in the upper body. In particular, painful lymph nodes may accompany breast cancer, lymphomas, and respiratory cancers. Some people may also experience painful lymph nodes as a side effect of cancer treatments such as radiation therapy, chemotherapy, and surgery. Cancers that commonly cause armpit pain include lymphoma, or cancer of the lymphatic system, leukemia, or cancer of the blood-forming tissues, including the lymphatic system and bone marrow. Cancers that have spread from another part of the body, including breast cancer, which develops nearby. Lipomas. A lipoma is a lump of fatty tissue that feels rubbery. A person can move it around under the skin. Most lipomas are non-cancerous and do not cause pain. However, lipomas that grow rapidly can cause pain by putting pressure on the nerves or blood vessels. In these cases, doctors may recommend surgery to remove the growth. Boils or ingrown hairs. When inflammation occurs in a single hair follicle, a boil or furuncle may develop. Boils are red, swollen lumps that are tender to the touch. When neighboring hair follicles become infected, the underlying tissue may feel inflamed and painful. Diabetes. Diabetes can give rise to neuropathy or nerve damage, causing burning pain in the affected body part. Diabetic neuropathy may develop in people whose blood sugars are consistently too high. Some autoimmune conditions. Lupus is a long-term autoimmune condition that causes inflammation throughout the body, including in the lymph nodes. Rheumatoid arthritis is another example. This condition can lead to swelling and inflammation of the inner tissues of the joints, which may affect the armpit. Psoriasis is an autoimmune condition that has effects on the skin in various parts of the body, including the armpit area. It can lead to different types of plaque or scale developing on the skin, as well as itching, discomfort, and pain. Hydrogenitis Superior. This is a chronic condition that causes inflammation of the sweat glands beneath the hair follicles. It often affects the armpits and groin as the skin rubs together. Symptoms usually begin as pimple-like bumps or blisters that turn into cysts and boils. Eventually, these wounds may burst and leave scars as they heal. Shingles. Shingles causes a painful and scaly rash that often affects the chest, back and armpits. The rash usually clears within 7 to 10 days. Peripheral artery disease. Peripheral artery disease narrows the blood vessels carrying blood away from the heart. It is more common in the legs but can affect the arms. Arteries carry oxygen-rich blood to the muscles. Without oxygen, muscle cells begin to wither and die, which can cause intense pain. Symptoms. Different conditions cause different symptoms, including skin rashes, lumps and swelling, and pain when moving. Armpit pain on its own may not need medical attention. However, if it continues for more than 1 to 2 weeks, a person may consider speaking with a doctor. People with weakened immune systems may need to consult a doctor earlier to reduce the risk of infection. Breast cancer. Swelling or lumps around the collarbone and armpit may be a sign that breast cancer has spread to the lymph nodes. Occasionally, this is the first sign of the disease. Doctors may recommend a biopsy to find out if the nodes are cancerous. If they are, doctors often perform surgery to remove them. People typically have between 20 to 30 lymph nodes in each armpit, and surgeons generally remove fewer than 20. If the lymph nodes are cancerous, there is a strong chance that the cancer has spread to other parts of the body. When to speak with a doctor. People should seek medical attention if armpit pain becomes severe or interferes with daily life. People should consult with their doctor if they have swelling in the lymph nodes that lasts for more than 1 to 2 weeks without a known cause. Extremely sore armpits or lymph nodes that are tender to the touch. Swelling on multiple lymph nodes across the body, such as in the groin, head and neck. Fever and night sweats. Hard lumps in the armpit region or lymph nodes. Swallowing and breathing difficulty. Unexplained weight loss. Unexplained continuous exhaustion. Lingering skin infections, abscesses or boils, or other painful skin rashes. If armpit pain occurs with lumps and soreness in the area, it may indicate serious infections or an immune condition. Very rarely, underlying health complications can cause armpit pain. This include cancer, tuberculosis, some sexually transmitted infections, especially syphilis, cat scratch fever, which might occur due to a bacterial infection from a cat scratch or bite, HIV, which can cause a range of dangerous infections due to reduced immune activity. Treatment. The best treatment options for armpit pain depends on the cause. If a healthcare professional suspects infection, muscle strain or illness, they will almost always suggest rest. Armpit pain that occurs due to cancer or any of its treatments may require anti-inflammatory and pain medications. Controlling immune activity in conditions such as lupus and rheumatoid arthritis often helps reduce armpit pain. Prevention. Armpit pain may be the result of an accidental injury or infection and may not be completely preventable. However, people can take steps to reduce the risk of certain causes of armpit pain. People can reduce the risk of muscle strain by warming up properly before exercising and taking care when lifting or throwing heavy objects. People who have skin infections or rashes may be able to identify anything they are allergic and avoid using it. Keeping the underarm area clean and dry can reduce the risk of bacterial and fungal infections. By controlling their blood sugar levels, people with diabetes may reduce the risk of neuropathy.